I mean by telemedicine. When you are taught the use of the drugs, the contraindication of the drugs, the basic dosages of the drugs, you are already empowered, right? Unlike before, as BHW, you are only there to check the blood pressure, you are only there to check the heart sounds or the fetal heartbeat, right? But more than that, this is kind of an advancement in your training to get exposed to the actual medicines and the usage of these medicines. Now, you would say, oh, that's hard work. That's big responsibility. You don't worry, because in telemedicine, our goal is to connect the barangays in the internet so that you have consultant doctors and even nurses that in the event that you have problems here, since you are connected to the internet, you have ready healthcare professionals that can assist you. That's why, like example of this, what we're doing, most of the time, what happens in the barangay level, there is interaction now. Video calling, video teleconferencing with the grassroots healthcare workers. Because we know that it's very seldom that you can bring a doctor to the rural areas like this. It's very rare. In my case, I ask, most of the time, I am the first doctor who have been to the remotest areas in the Philippines. I am the first doctor. So, but we can bring the doctors in your area through the internet, so that is already the counterpart. Now, we're encouraging the local government unit to start connecting your computers to the internet because it will open doors, not only in healthcare, but even in training and education for livelihood. It will even a way to correct bad governance. Because if you remember, the reason why we're transforming the Philippines, now we're trying to cut corruption because of the social media. Because of the social media, no? The mayors now, the governors now, can easily be tracked because even ourselves, I'm in the U.S., we know what's happening in Basilan, in Maguindanao, or maybe this time I will focus what's happening in your barangay through the internet. And once outsiders will realize that the performance of these government officials are being monitored worldwide, then what do you expect? They will perform better. Right? Unlike if people don't know what's going on in the barangay. But if you have the internet, you know what to do with the medicines. You can closely connect with the doctors who are volunteers. At the same time, you can also monitor the medicines that are here, whether inuwi ninyo sa bahay ninyo yan, hindi nyo distribute sa mga poor patients. Because that's a practice. I know that's happening among midwives, nurses, and even government doctors. That instead of distributing medicines to the people, they bring it home. They sell it. In fact, they sell it. Is that good governance?